Um, I'm Dr. Ron Devere. I'm a neurologist specializing in disorders of memory and cognitive impairment. I live in Austin, Texas, and I've been in practice for probably about 40 years. And one of the goals that I've had was to educate the public and also primary care doctors about the subject of memory and changes in brain function that affect many of us on a day-to-day basis. And the reason I've elected to do this book is I have a lot of experience in seeing a lot of different people over the last 20 years with these disorders. The biggest problem out there in the communities and in the message to the public, doesn't matter whether that's in United States, Canada, or around the world, is that the feeling is that many people believe that if you have a memory disorder, that you're likely going to develop Alzheimer's disease. And as many of us know, the message is that there isn't much you can do for it. The disease gets progressively worse and then you die. And so the message is very, very negative. And in my practice, and I believe reviewing a lot of good scientific data, that the glass is really not empty. The glass is half full, and that a lot of these conditions are treatable, and even Alzheimer's is treatable. There are lots of medical diseases and other conditions that can affect the brain that are not even Alzheimer's. The other thing that I've been seeing in the last number of years is that the people are getting misdiagnosed as having dementia, which is not the name of a disease, but it's a disturbance in brain function, and many of them don't have it. They just have a little memory impairment. And so the concern that I have is, if you were diagnosed as having dementia and Alzheimer's, do you really have that disorder? And because it takes at least 45 minutes to do a proper evaluation, that's not always done in practice by a lot of primary care doctors who don't have as much time to spend with individuals. So the book that I've written is very basic. It talks about what parts of our brain are important for different aspects of cognition, like memory and judgment, reasoning, insight, speech, language, etc., and how our brain basically works in those areas. It's tried to make it as simple as I can with some diagrams. Sometimes it gets a little bit bogged down, but I believe most people would understand it fairly well. And then the big issue is, how do we evaluate somebody that has a memory disorder or has a complaint? The big things that, and then we do a simple office memory test. And from those three things, we can tell if this person is either normal for their age, or they're having some trouble with their memory, just mild, or they're having more trouble, different, and have what we would call dementia, which is difference. Memory disorders are just memory impairment. Most people can still function. They could live independently, but they come late to the doctor. They forget to take care, pay their bills, but they still live at home. But once the dementia term is used, a lot of those people need help. They need care because they have trouble making decisions. They may get lost driving their car. Much more complicated. And again, those are all treatable. And in my book, I have different causes of memory loss, and they range from thyroid deficiency to simple head injuries, medications that we take, even medicines for blood pressure, for diabetes, for sleeping. They can impair memory. And there's also a host of other conditions, such as vitamin D deficiency, B12, little strokes in the brain that people are not even aware of, and again, many more things that we try to find the cause and be sure we do. So most people who have a memory disorder we usually recommend an IQ test that's done by a neuropsychologist because it's a little more detailed. They spend about 3 hours and they really check the brain out very carefully. It's kind of the IQ test you may have had when you were younger, and it gives us more information. Then we consider x-rays of the brain so we don't miss a stroke or a blood clot, which can cause memory loss. And we do a series of blood tests. And at the end of the testing and test results, we go over the mechanisms, we go over what we think is the answer, and try to address a treatment. And most treatments that we do nowadays, regardless of the cause, is in our book. We talk about good exercise, which everybody knows about, 120 minutes a week of aerobic exercise, such as pedaling an indoor bicycle or riding a bike on the street or swimming, anything like that. And also it's important to keep the brain working. We used to joke, and we still do, about if you don't use it, you lose it, and it's really true. We'd like people to play games and puzzles and be social, and those are things that are granted, but they're not, particularly when people get a bit older. They have a tendency to get retired. They watch a lot of TV, and that's not terrible, but it's not as good as keeping your brain active. If we have vitamin deficiencies such as B12 or folic acid, that's easily corrected, and we measure that in the blood. And we follow people very carefully over 2 or 3 months at a time. And so, excuse me, some people get worse as time goes on, and they develop a state of dementia, which is much more severe. And if they develop Alzheimer's disease or they get multiple strokes, we have specific medicine that doesn't cure the condition but can slow it down. Many of you may have heard of a drug called Aricept or donepezil. That's one member of the family, Exelon, etc. And those drugs slow decline because in those diseases, a transmitter of the brain called acetylcholine, which many may remember is also in your muscles and nerves, is deficient because the cells are not working. And so these drugs tend to increase the amount of acetylcholine. And again, we can follow people for many years. We're still not there to cure some of these diseases, but they're all treatable. And most importantly is to get the diagnosis right, because you don't want to make a wrong diagnosis, miss something that's easily correctable, and miss a condition that has a different treatment program or prognosis. So the purpose of the book is to educate everybody and make it easy for even the general public to follow some of the ideas